Dear students, welcome back. In the previous session, we have discussed about arthrokinematics of the knee joint. Now in this session, we are going to discuss about locking and unlocking mechanism of knee, which also includes some intra-articular motions. Okay, so this one also we can consider in arthrokinematics of knee joint. So here and this, the incongruence of the femoral condyles and the tibial condyles resulting in the rolling and gliding of the condylar surfaces on each other. Okay, because of this incongruence of the femoral condyles and the tibial condyles, which results in rolling and gliding of the condylar surfaces on each other. The asymmetry in the size, here you can see the asymmetry in the size of the medial and lateral condyles also causes some complex intraarticular motions. So this one also causes complex intraarticular motions. Using weight bearing closed chain motion, if you see an example in the extension of femur on relatively fixed tibia. So now here the knee is flexed and it is extending. That means anterior roll and posterior gliding is taking place. Okay. After that, on the this movements are taking on the fixed tibia, isn't it? Okay. Now, if you see the extension of the femur on relatively fixed tibia results in, so now here the extension is occurred. Okay. In this results in additional motions. So still additional motions we can see in the extension. Okay, so what are the additional movements? As the femur extends to 30 degrees of flexion, okay, as the femur extends to about 30 degrees of flexion, the shorter lateral femoral condyle here, the shorter femoral lateral condyle completes its rolling and gliding motion. Okay, so on the lateral plateau of the tibia. Okay, as extension continues, the longer medial condyle continues to roll and to glide posteriorly, although the lateral condyle has stopped moving. So normally, as the femur extends to about 30 degrees of flexion, so from flexion to extension up to 30 degrees, so the femoral condyle, the shorter femoral condyle completes its rolling and gliding motion. Okay, as the extension continues, then the remaining gliding and rolling is done by the longer medial condyle. Okay, although when this lateral condyle stops moving. Okay, so up to 30 degrees of extension, the lateral condyle will roll and glide and it will stop to move. Afterwards, if extension continues, the remaining gliding and rolling motions are done by the longer medial condyle. Okay, so this is the thing you have to keep it in mind. So this continued motion of the medial condyle, this continued motion of the medial femoral condyle results in medial rotation of the femur. So it causes medial rotation of the femur on the tibia. Okay, So how this medial rotation taking place means taking this lateral condyle as a pivot point. Okay. So the medial rotatory motion of the femur is most evident in the final 5 degrees of extension. Okay. So after maximum extension is reached, then also after gliding and sliding of the medial condyle is also completed, and after that it undergoes this continued motion of this medial femoral condyle results in medial rotation of the femur, and taking this lateral condyle as a fixed point, that is pivot point. Okay, so that means it taking lateral condyle as pivot point, and the femoral medial condyle is going to rotate medially. Okay, so normally this medial rotation, this medial rotatory motion of the femur is mainly seen at the final 5 degrees of extension, and this one is very important to lock the knee joint. Okay, so increasing tension in the knee joint ligaments as the knee approaches full extension may also contribute to the rotation within the joint. So here you can see, so increasing tension in the knee joint ligaments. So normally during flexion all the ligaments are lax. Once the maximum extension is reached, all the knee joint ligaments become taut, and also once these all ligaments are becoming taut, then also we can find some sort of rotation within the joint. Since the medial rotation of the femur that accompanies the last final stages of knee extension is not voluntary, keep it in mind, is not voluntary or produced by any muscular force, it is referred to as autorotation, okay, or automatic or terminal rotation, automatic or terminal rotation of the knee joint. This rotation within the knee joint that accompanies the end of extension also brings the knee joint into closed pack position or locked position. So what happens in this position? Normally the tibial tubercles, here you can see, here you can find the tibial tubercle. The tibial tubercles are lodged in the intertubercular notch. These tubercles are going to fix into the intercondylar notch, and the menisci which are present on the tibial plateaus are tightly interposed. That means they are tightly packed between the tibial condyles as well as the femoral condyles, in between this thing. So what happens in this position? The menisci are tightly packed in between femoral condyles and the tibial condyles. Okay, and the ligaments are taut, So consequently the automatic rotation is also known as the locking mechanism or screw home mechanism of the knee. Okay, so this is the locking mechanism. Okay, what happens? So during locking, so from flexion to 30 degrees of extension, the lateral condyles, so the lateral as well as the medial condyles will glide anterior, roll and glide anteriorly. Afterwards the lateral condyle will not have any movement, that is gliding and rolling, and the remaining rolling and gliding is taken by this larger medial condyle, which helps in further extension. So at the terminal stages of the extension, all the ligaments become taut. Even though all the ligaments and the surrounding structures are becoming taut, still inside the joint there may be some rotation is taking place. That too, medial rotation of the femur is going to take place. That thing we can see at the 5 degrees of the terminal range of knee extension. So this rotation is not produced by any muscular forces, and this is not any voluntary rotation. So such kind of rotation is called as automatic or terminal rotation of the knee joint. Okay, so at that position, this intercondylar tubercles and are going to fix into intercondylar notch, and the menisci are going to tightly present in between the femoral condyles and the tibial condyles. Okay, and all the ligaments are taut, and this position is called as closed back position or locked position, and the mechanism is called as locking mechanism or screw home mechanism of the knee. Okay, and how this unlocking is going to take place now? To initiate flexion, the knee must first be unlocked. That is, the medially rotated femur cannot flex in sagittal plane. So then what happens? But must laterally rotate before flexion can produce. So for this, a flexion force will automatically result in lateral rotation of the femur, since the longer medial side will move before than the shorter lateral side of the joint. If there is any external restraint to unlock or derotation of the femur, the joint, ligaments and the menisci can be damaged, as the femur is forced into flexion oblique to the sagittal plane in which the structures are oriented. Okay, this automatic rotation or locking of the knee occurs in both open chain and closed chain knee joint function. Normally this unlocking is stimulated by the popliteus muscle. Okay, the freely moving tibia laterally rotates. The freely moving tibia in open kinematic, the freely moving tibia laterally rotates on the relatively fixed femur during the last 30 degrees of extension. Consequently, unlocking will take place, and which is brought about by the medial rotation of the tibia on the femur before flexion can be produced. Okay, this is the locking and unlocking mechanism of the knee. Okay, so this is all about locking and unlocking mechanism of knee. In the next session, we are going to discuss about knee joint musculature. Thank you.